Thank you everyone for joining today. We will get started. So my name is Callie. I am the program coordinator here at the Congressional District Health Dashboard. I run all of the communications and these virtual office hour sessions. So if you have any questions, feel free throughout this recording webinar to just pop them in the chat, or at the end, I'll have a live Q&A session so you can just take yourselves off mute and ask live, and I'll be here to answer any questions that you might have. So without further ado, we'll get started. So here at the dashboard, we've been around officially for 1 year, which is really exciting. About a little over a year ago, we realized that nonpartisan data at the congressional district level just simply didn't exist free and widely available for everyone to kind of look at and use in their work. And so we wanted to change that. My team here also had created 5 years ago the City Health Dashboard, which provides similar health data, but at the city level. And so we built off of those learnings to create the Congressional District Health Dashboard to be able to provide this data to folks so that they can use it in their policymaking and decision-making. So our goal here at the dashboard is to provide granular data at the district level. We know that data itself is powerful, but data on its own can't change policy. However, it's a very important ingredient to doing so and to providing better health for everyone in this nation. Data can help illuminate challenges and assets in communities that may have otherwise been hidden. Data can inform effective policy solutions. What might work in one community might not work in another, and data can really highlight that. And then finally, data could also be used to hold leaders accountable. So are they living up to their commitments and responsibilities? So here at the dashboard, we hope that all of our data is able to be used by a wide audience. We are targeting mainly elected officials and their staff, advocates, journalists, researchers, media, and of course the general public. We want everything on our site to be as user-friendly as possible for anyone, from the most data-savvy person to someone who's never really seen a graph before. And so we try to make it as accessible as possible. And as I said a little earlier, we are building this website based off of our learnings from the City Health Dashboard, which has been around for over 5 years now. So we've had some good practices from there. And then as always, we're continuing to learn, we're continuing to take in user feedback and seeing how we can continue to improve our site so it's the best site possible for you guys, the users. So as of right now, we have 37 metrics on the site. We did add 3 new metrics as of this past month. So chronic absenteeism, air pollution, ozone, as well as Medicaid enrollment. This was from some user feedback as well as data availability. The dashboard's data are drawn from federal sources and other data sets that adhere to our rigorous standards here of data collection and analysis. So every metric that is on the site, we really can stand behind and say, this is data that we believe in, we know how it's been collected, and this is something that we really support and stand behind. And so anything that's put on the site, we're able to fact check everything, and we have all that information as well on the site. So some of these data sources include the US Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. Here on the team, we are a team of population health and policy experts, epidemiologists, and geospatial specialists. And we regularly update the dashboard with new years of data, new measures, relevant policy, resources, and much more. As of right now, we are aiming to update the dashboard about once a year as new data becomes available so that everything is as up to date as possible. Here on the site, we have most data is available with multi-year data, which means that you can compare between years and look at least 2 years of data on the site. Everything on this page with a little asterisk also has demographic breakdowns available. So that could be by race, ethnicity, sex, and or age. These little triangles here mean that you can break down the data even further into the census tract level. So once you go into a district, you can actually break it down by basically neighborhoods and get even more granular data on whatever metric has this triangle feature. So we really have a lot of data, and we try to share as much as possible with you guys. So we select our metrics based on the following criteria. We want to ensure that every data set is national, so it's going to cover every single district on our site. We check to ensure that there are rigorous methods underlying the original data collection. All of our measures, we want them to be actionable and reflect upon public health priorities at the national level. And then we also ensure that there are regular updates to all of the metrics over our 5 overarching domains. So that's just a little bit of background of the site and who we are. And now I'm going to give you guys a quick little demonstration of the site, and so we can walk through it a bit. So let's go here. So if you type in Congressional District Health Dashboard, this is going to be the site that comes up. As you can see, we have 37 metrics, covers every single district. If you don't know your district, this is a new feature that I'll talk about in a second, but it's a district locator. So for instance, I could type in my hometown. I grew up in Burbank, California. So I could type in my zip code. I could click here and it will then pull up the district that matches that zip code information. So here it's California 30th. So I can click into view district, and what it's going to bring you to is this district snapshot page. Now, if you already know the district that you want to explore, you could also alternatively on that first page, just type in the district right away and it will bring you to a similar page. So this is the snapshot for California's 30th. Here you can see the 5 metric domains that were previously on that metric slide that I had. We break it down by physical environment, health behavior, health outcomes, social and economic factors, as well as clinical care. Here on the right, we have them sorted by different symbols. So if you have a yellow triangle, that's representing that this district or that particular metric is around the US average. If it's got a green circle, that means it's doing slightly better than the US average. And if it's got a red square, that means it's doing slightly worse than the US average. So as you scroll through, this is a great way to get a general idea of how your district is performing in relation to the national average. If you want more information on a particular metric, you can hover over here and it will tell you just a general gist of how is this measure calculated, what's the year of data that it's showing, what is the original data source, and you can also click here to go more about the metric, and it will pull up this page, which will link to a data source if applicable, give you a little bit more of a sense-making statement or a statement that explains it a little bit, the measure in more layman's terms, so you can kind of understand what's going on. And then you can read throughout to see our background on what is this metric, what might be some strengths or limitations, how is it calculated, data source, and any relevant references that we make note as we went through. So I'm going to go back here to the district snapshot page. Another great way for you to kind of explore districts, say you're only interested in health outcomes and health behaviors, we have a filtering option here. So in this filtering option, you're able to now just only see those metrics that fall under health outcomes or health behavior categories. So as you go through, we can see that there's a variety of metrics here. Say I'm interested in frequent mental distress. I see that my district here is performing around average, but I actually want to see the map. There's 2 options here. You can either click explore the map, or you can click directly on the feature to be brought to this metric maps page. And what this will show you, so if you click it through the district snapshot, it will only show you your district. However, you're also able to view the entire map of the United States here, and this gives you an overview using this gradient scale up here of how the entire country is performing for this particular metric in whatever time period you selected. For frequent mental distress, you're able to select from any year from 2019 all the way up to 2021. So you can compare between the years here if you would like. This scale bar doesn't change in terms of the orientation. However, the max and mins may shift depending on how the performance was in that particular year. Here you can also kind of scroll in, scroll out, and explore around. If you wanted to click on any of these districts, you can get how they're performing. It'll pop up the little estimate for that particular district. If you want to zoom in on any, for instance, South Dakota at large, you can click on the district here. As I mentioned previously on that metric slide, we also do have quite a few metrics where census tracts are available. This is kind of a proxy to a neighborhood level estimate. So when you click it here, it might take a little bit of time to load, but what will come up is an estimate based on neighborhood level data for this particular district as opposed to just the district at large. We'll give it a little moment to load, and here it is. So now you can see without census tracts, it is just the entire district, which is on average 11.4% of frequent mental distress. If you click show census tracts, now you can see which particular neighborhoods within that district are facing more challenges versus which ones are facing more success. And again, you can click in and kind of see the differences in the estimates here. If at any point you want to change metrics to any of our other metrics, you can do so by clicking change metrics and click into a different metric here. Briefly, I'll just once again go into this metrics by demographic page. Here, let's say I once again, well, let's actually just go here and scroll to Maine's first district. You'll then see that there are these are the metrics that we have available that are able to be broken down by demographic information. So say I'm curious about high school completion in Maine's first district. Here it's showing estimates for 2022, and you can see how many females versus males graduated from high school in 2022 in Maine's first district, as well as a breakdown by race and ethnicity here. If there is this little tooltip at the end, that might be some information about this particular estimate that might mean that you want to look at it with a little more caution or need some more information to understand the full context for this. Yeah, and then from here, you can also go and navigate back to various parts of the site, such as the map of high school completion for the first district, or you're also able to get a snapshot for all of Maine's first. These are pages that we've already navigated to previously. The last thing I want to highlight on our site is that every single data point that is able to be viewed on these maps, the demographics, any of those, they're all available for free for download in this access the data page. It may prompt you with a little form when you first go to the page for the first time. This is just so that we have an idea of who's downloading the data and so that we can contact you when data has been updated. Once you go through that form, you'll be met with this page. Here you can see the technical document and codebook. The technical document is a great place if you have further questions about how a particular metric has been measured, or if you have questions about the data source or any little data tip that you see on the site, you can go here and all of that information is documented, written down, and you're able to find it here. If you're curious about how we have actually coded and calculated our metrics, the codebook will give you more of that information. You are either able to download our data for all congressional districts or by a particular state. So it's a little easier for you. So that was a lot of talking and a really brief overview of our site. It's very comprehensive and you're able to explore, as I said, 37 metrics listed out all here. We'll be able to go back in the live Q&A if you want to explore any particular measures of interest or districts. But for now, I'll continue really quickly just to talk about how we've grown and changed our site over the last year. So it's been, as I said, 1 year of the Congressional District Health Dashboard, which we're really excited about to see how much we've grown in the past year. So since we launched last year in January, we have since added 3 new metrics to the site: chronic absenteeism, which measures how frequently absent are public school students. This is a very good indicator for certain health outcomes, and so having less chronic absenteeism is tied to better health outcomes. So this is a really good measure to look at, and this is at the school district level, but we've aggregated it to the congressional district level for your understanding. And then we also have air pollution ozone. This we have created a monthly metric, so you're able to compare in your district between months, which is really neat because again, air pollution can really vary between seasons and different areas of the nation. So this is a really great way to kind of see that change over time. And then we've also added Medicaid enrollment. So this is taken from the Centers for Medicaid and Medicare. And we have provided a percentage of Medicaid enrollees as a proportion of quarters throughout the year. So we have the last 4 quarters on our site as of right now, and you're able to explore that for every district. and the country. We've also added census tract level data for 24 metrics. So again, that is a basic proxy for a neighborhood level data. We also have demographic details. So we continue to add these as they become available for more metrics. We started out with just 14 and now we have up to 16 metrics that have demographic details available. Almost all of our metrics now, except for two, have multi-year data available. As the data becomes available to us, we make sure that in that next release, we make it available to you. So the only two metrics that don't have multi-year data, it's just because they simply aren't available for anyone at the moment. If they were available for us, we want to make sure that you're able to access that as well for free. And then our last few things came from actual user feedback. So either from these virtual office hour sessions, folks reaching out to us via email, or seeing us at a conference. We have heard that these are really good tools that people wanted. So we made sure to make it so that on the metrics overview page, you're able to filter district locator so you can search through for your district if you don't know it off the top of your hand. And then a blog and media page to cover any releases or updates that we've had on the site. We want to make sure that that's easy to find. So I'll kind of go through now very quickly an overview of some of these functions. I touched on these a little bit in my demonstration, but I just want to highlight them more specifically to show how the site has changed. So for this one in particular, we added this show census tracts metric. This is what the site used to look like before. This is highlighting Massachusetts 5th District for preventive services for 65 and up. This metric measures how many adults who are greater than 65 are up to date on their current clinical preventive services. So if you then click on this, you can see that this is now broken down by census tract, and you're able to see that these min and maxes have also shifted based on the census tract data. This is a cool little data fact that we found. So we did a little bit of an analysis, our last release, and we found that when we're looking at broadband connection or internet connection, being able to see the census tract versus just the district gives you way more information and more granular data for all of these districts. So we saw that Virginia's 11th was in 2021, the district that had the highest broadband connectivity in the whole nation. But as you can see, when you actually look at the census tract distribution, they range from their lowest census tract having around 26% connectivity to their highest one having 100%. So it tells a very different story than if we were just looking at the district estimates. So this is a really interesting way to kind of view the data and understand what could this neighborhood level data do to add on to your understanding of the district level data. Next, we added multi-year data. So this is showing right now for children in poverty. We have the years 2020 all the way to 2022. You can look at this, the national level, the state level, the district level, and it shows you the comparison over the years. A part of our analysis last year that we looked at was rent burden, and we created this graph that shows the districts between 2020 and 2021. There was 60.8% of districts across the nation that had greater rent increase in 2021 than they did in 2020. And so you're able to, again, compare across these years. You can look and see if there's any trends or areas that have greater success, more challenges, and see how can you best target your resources and find areas of policy focus. Next, we have this metrics overview filtering. As I said, every metric is filtered into one of 5 overarching domains, which are listed out here. And if you want to just explore by one, you're now able to do that in the filtering technique. District locator, these are 2 examples. So this one was my hometown, as I said. If I type it in, only one district comes up as a possibility. This is another possibility of a district where if you type it in, there might be multiple congressional districts, and this search function will show you any of those. You can do zip code, as these 2 examples are here, or you could put in an actual address that will give you very specifically where it is in that particular district. And again, we didn't take away our original function, which if you know the district, you can just type it in, but this is greater accessibility so that anyone can find their district, even if they don't know it off the top of their head. Finally, we added the blog and media page. This is an example of our latest release and our 1-year anniversary blog. You can look at that here. We released a new video series where we're going to be giving kind of like virtual office hours, but in animated form, an idea of the user journey throughout. So we've launched that video series. We also are highlighting news articles we've been found in, as well as noting any of the data release updates that we have. You can find all of the articles that we've ever written or any of our media coverage in this blog and media page here. You can filter by any keyword, type of article, as well as any metrics that are highlighted. And that is my spiel. Thank you so much for joining. I'm going to open up the floor now to you guys. If you have any questions, if you want to explore the site more, I am here for the rest of the hour to walk through anything with you.